Hi guys, welcome back to Let's Go Mental. My name is Warime. Now in today's video, I would like to discuss about what you need to know before you start taking medication. Now you'll find most of the time when you're diagnosed with depression, for example, or anxiety, if you're found to be severely depressed or have severe anxiety, most of the time the psychiatrist will recommend that you start taking either anti-anxiety pills or antidepressants just to be able to stabilize you and to enable you to function optimally and be able to carry out your day-to-day activities. So it's very important to take your medication. I know there's a lot of pill shaming, people talking negatively about medication, and it's true. Antidepressants, antipsychotic drugs, all those drugs have side effects, just like any other drug that you take, be it an antibiotic, painkillers. Every medication has a side effect. It's just that we haven't gotten to a point whereby we are able to fully understand and fully accept that probably these are the side effects that I may experience while I am taking a certain medication. So I've put together a couple of questions I feel that you can ask your psychiatrist once they prescribe you a certain medication. So it could be that probably you were taking a certain drug and your body has become resistant to it. So the psychiatrist has decided to switch to another drug. So of course you need to ask questions about it. And the second option is if you have recently been diagnosed and you need to be put on certain medications, it's also important to ask your psychiatrist some of these questions. So the first question you'd ask is, what is this medication supposed to be? Is it a mood stabilizer? What exactly is it going to do for you? What effects is it going to have on you? What is the benefit of actually taking this medication every single day? Second question you can ask is, when will the medications begin to take effect, and how will you know when it's taking effect? So that is another discussion that you really need to have with the doctor, so that also as yourself, while you're under that treatment, you can be able to tell, like, is this medication actually working for me? I was told that it should probably take the headaches away, or it should probably be able to uplift my mood. So how can I be able to gauge and know that, and know whether this medication is actually working for me or not? So that's the second question. Another thing you can ask is, what food or drinks should you avoid? Because there are certain medications you'll find, for example, if you're on anti-anxiety pills, it is always advisable not to take coffee, because you see, coffee is a stimulant and it can have actually negative effects on the pills that you're taking, and also can also have a negative effect on the anxiety disorder on its own. So find out, what food do I need to avoid? Also, what other medication do you need to avoid when you're taking that specific antidepressant or anti-anxiety pill? So are there certain maybe painkillers I need to avoid? Are there certain probably antibiotics that I need to avoid? So it's very important to get to know what exactly you need to avoid while you're taking that specific drug. Another thing you can find out is, how long does the medication take to start working on you? So is it going to take immediately? Is it like a painkiller where the pain goes immediately? Does it take 2 weeks? I know for me, all the medications that have been put on, most of them start taking effect after 2 weeks. So that's when you start actually feeling like the drug is actually working for you. So that is also something else that you need to know, so that you can be able also to be your own doctor and gauge and see whether this drug is actually working for you. Another thing you can also ask is, how should the medication be taken and for how long? So basically, you're going to find out, am I taking this drug in the morning or am I taking it at night? What dosages am I taking and for how long? Are you putting me on these drugs for a month? Is it for 2 months? What is supposed to happen after that? Let me give an example on this specific point of how the medication is taken and how long it takes to take effect. I was put on a certain pill last year, and I was supposed to take this pill in the morning. The doctor had indicated as much, but when I went to the chemist, they indicated that I should take it at night. So for almost a whole year, I kept struggling with insomnia, and I kept wondering what the issue is, because I'm currently on medication. I should be able to wind down at night, but towards the end of last year, I actually was speaking to the doctor about my medication, and I was telling her the way the insomnia has not gone, and she just happened to ask me, by the way, how are you taking the drugs? And we got to find out that the drug that I was taking at night should have actually been taken, I should have been taking it in the morning. So meaning that this drug was actually the one that was causing me to have insomnia. So it's very important to ask the doctor how exactly you should take the particular drug and for how long. 6 months, a year, what exactly are we looking at? Another one is, what should you do when you miss a dosage? So this is something very important. Of course, it happens. I'm telling you, I always accidentally miss my medication all the time. But what I've come to learn is that if I say, for example, miss my morning drug and I remember it at 3 p.m., I should not take it at that point. I just count that as a missed dose and then I take it now the following day. So it's very important also to find out what you need to do when you miss a dosage. And there are certain drugs actually that are very, very sensitive. There's one particular one I'm taking called quitipine. And when I miss one dosage, I start feeling the side effects immediately. I start sweating, I constantly get goosebumps, I have hot flashes. So it's very important to find out what exactly should you do when you miss a particular dose. Then the other question you can also ask is, what resources or where can you find more about this drug that the doctor has prescribed for you? Okay, nowadays we have a lot of resources on Google, but you can also ask the doctor if they can direct you to any resources that you can read more about the drug that you're taking. It's very important to read up on this because this is something that you're putting into your body and you need to fully understand about this specific medication that you're taking. Another question you can ask is also that, are there other medications that are appropriate to treat your condition? So for example, I mentioned that I take a drug called quitipine. So before I started taking it, I asked the doctor, what other options do we have in this range of drugs that I can take to help me with my condition? So you can be able to discuss that and she can tell you exactly why she has chosen, say for example, to put you on quitipine and not another drug like say mirtazapine. Another very, very important question that you need to ask is, what are the side effects of the drugs that you're taking? This is a very, very important question, and in fact it should have been the first thing that came after what the medication is supposed to do. It is very important to find out what the side effects are. Discuss this with the doctor. I know there's a specific drug that I was put on beginning of I think 2018. It was called mirtazapine. Now mirtazapine makes you hungry 24/7. So you can imagine you're constantly eating and it's a hunger that you cannot ignore. So you'll find yourself constantly eating. And I remember beginning of 2018 when I was on that drug, I actually added 10 kgs in a span of 2 months. So definitely I had to go back to the doctor and we had to look at other options of drugs that I could take that would not make me now continually add weight. Because you can imagine that was in 2 months. I added 10 kgs, I think it was 8 or 10. So you can imagine now by this year, I probably would have been more than 100 kgs if I'd continued on that drug. So you need to find out what are the side effects. Will they make you sleepy? Will they give you insomnia? Will they make you hungry? Will they make you lose your appetite? Because there are also some pills called lamictal that I'm on, and I know they make me lose my appetite. But now there are other medications that are able to stabilize that, and my appetite is stable and just normal as it should be, whether I'm on drugs or not. So the last question that you can ask is, how do you monitor the medication and what symptoms should you look out for in case the drug is not working? So you also need to discuss this with your doctor. You know, there are times probably you'll find yourself maybe getting headaches. For example, I know one of the things that happens with me is that I tend to get headaches. And if these headaches stay for a prolonged period of time, say a month, 2 months, then I know that there's a problem and I need to go back to the doctor. Either of course, there's the aspect of going for therapy because maybe there's something that has affected me, or if not, we need to now review the medication and find out exactly whether are the headaches being caused because of the medication, or is it another reason? So those are some of the questions that you can ask your doctor when they prescribe for you a new medication, or if you're recently diagnosed, when you're starting those pills. So guys, if you have any other questions that you feel that we can ask our psychiatrists when we are being given medications, please put them down in the comment section below. We continue having this discussion. And lastly, guys, please let's stop pill shaming. If you know you have a mental disorder and your doctor has given you medication, please kindly stick to your treatment. You'd rather try that and you'd rather try that and see whether it will fail than not try it at all. So just keep trying the different treatment options. Of course, remember, while you're on medication, you also need to go for therapy. They need to always go together so that you can be able to continue living happily, be productive, and basically live a normal life. So guys, thanks again for tuning in. We shall see you in my next video. Goodbye.